观众朋友们，晚上好！欢迎您收看由凤凰卫视每周台为您带来的天天话题栏目，我是小诗。白内障呢是影响视力的最常见的一种眼科疾病之一，尤其呢是随着大家越来越长寿的今天，几乎成为了一种不可避免的眼疾。然而呢，根据白内障有关的话题啊，实在是很广很复杂。那不知道大家又了解多少呢？今天我们就为您连线来自比弗利山庄眼科诊所的眼外科医生 Dr. Billy Pan。Hello, Dr. Billy Pan. How are you? It's good to have you with us today.
Thank you very much. It's good to be here. My name is Dr. Billy Pan. I am a cataract and glaucoma specialist at the Beverly Hills Institute of Ophthalmology.
Dr. Pan, I heard that as we get older, eventually everybody gonna get cataract. Is that true?
Correct. Cataract is a condition that everybody will inevitably get over time as one ages.
So it's absolutely normal for people to have cataract, but we don't have to worry about it too much.
Absolutely correct as well. It is an inevitability. However, I don't really consider it a disease. I consider it a condition, and everyone does get it, and it's not particularly dangerous, thankfully.
So are there any other factors that will cause cataract besides age?
Time being the main factor, but also exposure to UV light, exposure to reactive oxygen species, changes such as diabetic changes in the eyes with diabetes that's not well controlled, or a history of trauma to the eyes, inflammation inside of the eyes. A lot of things can contribute to the formation of cataracts even earlier than we might expect.
I wonder, where does cataract exactly grow inside of the eyes?
So the cataract, I have a scale model here. So this is a scale model of an eye. If we remove the top half of the model here, I have what you can see is the front surface of the eye here, and then the back of the eye is here. The front surface of the eye is called the cornea, and that is clear. And this is when we do LASIK. We do LASIK at this part of the eye. And sitting just behind the cornea is a clear lens here. This time, once it gets cloudy, that's when it becomes a cataract. So it's actually towards the front part of the eye.
So people can actually see it when it's pretty matured.
Yes. So through our microscopes that we use to visualize and examine eyes, we can see the cataract very easily. We can also grade it based on its severity.
Dr. Pan, a lot of people have short-sighted. For those kind of patients, well, cataract causes a change in their prescription, like make it worse.
Yeah. So for patients who are short-sighted or nearsighted, or even if they're farsighted, the change of the cataract, the growth of the cataract over time can cause a change in the prescription as well. So one may notice that on a yearly or every other year basis, the prescription can change, and that may very well be because the cataract is growing ever bigger and also stronger.
For farsighted, do you mean presbyopia?
For farsighted, I mean patients who are what we call hyperopic. Presbyopia is when patients are getting to a stage where reading or near work becomes more difficult without the assistance of reading glasses.
Okay, sometimes I know when you have cataract, it will also cause glaucoma. Is that right?
That's absolutely true. Cataracts can grow and also result in glaucoma. These are the types of glaucoma that we call angle closure type of glaucoma or narrow angle types of glaucoma. And for these particular patients, removal of the cataract earlier on in the stage of the condition of the disease would be a better situation.
Sounds like it's very serious. So once the cataract is found, we need to see a doctor right away. Is the best way to cure it, because at least to monitor it. Otherwise, we can just leave it there to make our vision worse and worse, even blind to the worst scenario.
So cataracts, when they are found, they're usually very, very slow growing, which is the good thing.
How slow, you mean?
over the course of usually decades, so 10, 20, sometimes 30 years before they actually become a problem. So it really depends on the patient and the patient's eye. Some eyes can have a cataract and not have any problems for 30, 40 years. Some patients might have a cataract that becomes problematic after 10 to 20 years. It's very difficult to say who will have a cataract that is not going to be a problem and who's going to have a cataract that may be a problem earlier. So it's important to be able to see an eye care professional on a yearly basis.
Right. So since it sounds like inevitable, so what do we do if we have cataract, or what are the treatments in general?
Well, the treatments for a cataract, if a cataract is present, as of now, is surgery. So some type of surgical procedure to remove the cataract. And once we remove the cataract, then we can put in what we call an intraocular lens, or an artificial lens in the eye that in place of the cataract. This lens will be able to focus light, help you see clearly. And thankfully, this is something that stays in the eye forever.
Oh, okay. If the cataract is not that severe, is it necessary to do the surgery? Or is there anything we can do to restore the vision back to 2020, like wearing glasses or using some eye drops, eye medicine? I don't know.
So once cataract is formed, surgery can be part of the solution. However, updating a pair of glasses can potentially get a patient back to that quote-unquote perfect vision of 2020. And so it's not necessary to get cataract surgery as soon as a cataract is found. In fact, sometimes it's too early to do so. And the risks outweigh the benefits of doing cataract surgery. So a pair of glasses, updating a pair of glasses, wearing contact lenses, if that can be helpful enough to help prevent or help keep a patient's vision sharp, then that's usually sufficient. As of now, drop therapy for prevention or regression of cataracts is not in its maturity yet. It's not in trials for humans, but there are some ongoing trials and studies in animals as of this time.
But if it's too mature, it might cause the risks and difficulties to the surgery?
If cataract is too mature, it can cause a few problems. Number one, it can cause glaucoma. The more mature a cataract is, the higher the probability that glaucoma can be a problem, especially in patients who have smaller eyes and have narrow ankles. Also, if a cataract gets really, really dense and very large, then it does become a little bit more of a challenge to remove from the eye. So I usually recommend that patients don't wait until it's too far along, because it just makes what is usually a routine surgery for us a little bit more complicated without the need.
Yeah. We often hear that you have to wait until the cataract to mature to have the surgery. Does this concept still can be applied to the modern medical concept?
That's a good question. And I think that the answer is not a straightforward answer. I think the surgeon that you talk to, and I think it depends on the patient that you're dealing with. For some surgeons and for some patients, the surgery should be reserved for something that's very, very advanced. In these cases, doing something too early for an early cataract would not be a good idea. However, we also have an array of new lenses that can be put into the eye that restore vision, not only at distance, but also up close. And there are patients who, even younger, quite a bit younger.
Like 40s?
I would say late 40s would be the youngest, but we're probably talking about 50s and into the early 60s would be young age to get cataract removal and have placement of one of these special multifocal lenses that can give you vision into the distance, to the computer, and also up close. And also, this basically helps to relieve or reduce the amount of glasses use that the patient has.
So is there a time when eyes are suitable for surgery, or is it reasonable to have the surgery operated on at any time once the cataract is found?
The answer is that the cataract can be removed really at anytime, depending on the patient. That's the answer that I think would encompass most individuals. What that means is some patients, again, who don't want any surgery, they don't need it until the cataract is really, really blocking the vision, and it makes it hard to go about a person's daily lives without bumping into things, and also maintaining the safe ability to drive. Then on the other end of the spectrum are those who are very young. Again, we're talking about usually 50s, sometimes into the early 60s, who want the lenses removed so that they can have an artificial lens placed called the multifocal lens that can give them better visual abilities, often to the distance and close. So the range and the spectrum of age for which a patient is appropriate for cataract surgery is pretty wide. It's really dependent on the person's personality and also the patient's visual needs.
So it really depends on the patient's own situation. So I'm wondering that currently what surgical techniques are available when undergoing the surgeries. Like, I believe a lot of people are curious about what's the latest technology for cataract surgery.
So cataract surgery, globally speaking, is done one of three ways.
Mm-hmm.
First way really is not done in most Western countries as much now.
Mm-hmm.
It's one called manual small incision cataract surgery, where only blades are used to remove the cataract and place the lens. It's an excellent and a very elegant way to do surgery, but in society here in the United States, we've moved away from that for the most part. The second type of surgery is using something called Fecal Emulsification. This is ultrasound energy. This energy basically helps to reduce the cataract, which is like a small pebble in the eye, and take it from a hard substance down into a liquid. And then we can just remove the liquid with a vacuum. And then the third way of removing a cataract, which is more prevalent now and slowly gaining a little bit more use, is something using a femtosecond laser technology. This laser essentially helps to soften or melt down the cataract before we get to it using the fecal emulsification and the ultrasound energy.
Mm-hmm. So how long does it take for the surgery? Is it the same among these three different types of surgeries, like the process?
In skilled hands who have done a lot of these type of surgeries, each of these different types of surgeries should take probably somewhere between 10 to 20 minutes.
Mm-hmm. That's pretty fast.
It's a very fast surgery. It's a very commonly done surgery. It's a very successful surgery, which is why it's a very, very, it's a surgery that a lot of patients really look forward to because they know that they can improve the clarity of their vision afterwards.
Mm-hmm. How about anesthesia?
So anesthesia is what we call MAC, or monitored anesthesia care. What this means is that there's an anesthesiologist who is at the bedside the entire time, making sure that the patient is not in any distress. Mm-hmm. Now, cataract surgery itself is a painless procedure, meaning that I will give my patients anesthesia in the form of drops on the eye and also some anesthesia inside of the eye. And the combination of those two is sufficient to keep the patient feeling nothing from the surgery. So the purpose of having our anesthesia team members in the surgery is to make sure that the patients just don't feel anxious during surgery, as most patients do feel a little anxious if they're getting surgery.
Yeah, you're talking about a lot of patients, they feel anxious. I know, because I'm the person that as soon as I hear about surgery, I got scared off. So I believe a lot of people like me, if I do surgery, like cataract surgery, I would rather choose general anesthesia to not feel it at all because I got scared, and I want to feel like the total process is like just having a good sleep. So can patients choose general anesthesia for cataract surgery?
That's a good question. Cataract surgery is usually not done for general anesthesia because the surgery is it's so quick. And again, it is a painless procedure, and it's such a routine procedure that we can do the surgery with a patient awake. And we have excellent results doing so. To have general anesthesia means that a patient needs to have some kind of artificial breathing mechanism. This increases the risk of the surgery because of purely the anesthesia that a patient gets. So having general anesthesia actually is not a good idea for the vast majority of patients who are undergoing routine, uncomplicated cataract surgery. Because once again, there are risks associated with anesthesia and there's risks associated with general anesthesia.
Got it.
There are rare circumstances where a patient who cannot cooperate and who may be prone to movement, especially unexpected movement intraoperatively, that we would deem appropriate for general anesthesia just to make sure that the case goes smoothly without any complications.
Got it. So after the surgery, I wonder, how long does it take to recover?
For a routine cataract surgery, you're looking at recuperation of vision really within about 24 to 48 hours from the surgery itself. And you're looking at about a 1 week time to get the first big increase. You're looking at about 1 week's time to really notice the big improvement compared to preoperatively. And we say most patients get to a nice, stable postoperative result at about the 1 month mark.
Also, what should patient be careful of after the surgery?
Certainly, you want to make sure that you're not rubbing the eye because there is a fresh wound and it's been just braided on. And so we usually put a shield on the patient's eye just in case they don't remember that they had a surgery and they try to go rub the eye. And also afterwards, you want to make sure that you have good hygiene around the eye, meaning that if you normally wear eye makeup, that you don't wear eye makeup. And also we prefer...
So wear makeup for how long? 1 week?
I usually advise my patients not to wear eye makeup for approximately a week and a half. I'm conservative.
Okay.
And also prefer patients not to get any tap water in the eyes, as tap water can harbor bacteria that can cause infections in the eyes.
Of course, washing your hands before using any eye drops, especially during this coronavirus time.
Absolutely. There will be some medicines that we will prescribe to patients who that we will expect the patients to use postoperatively to prevent infections and also to speed up healing. And those drops should be used with caution, making sure that the hands are washed before using the drops and that the drops are used appropriately and according to instructions.
And how often should a patient see a doctor after the surgery?
Usually our protocol is to see the patient within 24 hours of the surgery itself. So that oftentimes ends up being day 1 out from surgery. And then depending on how the patient looks, it could be a week after surgery and then a month after surgery.
Last but not least, is there anything we can do to prevent it from happening if we don't have cataract like right now?
So as we discussed from the very, very beginning, this is a condition that eventually everybody will get. So I don't want patients to ever feel disappointed or sad or scared when they're told that they have a cataract, because again, it is something that we all will eventually get at one point. But to slow down the progression of a cataract, one generally just needs to live a healthy lifestyle that you would expect to hear from your primary care doctor about maintaining good cardiovascular health are the same things that I would recommend to patients to reduce the progression of a cataract, such as regular exercise, leafy green vegetables, having lots of healthy fatty acids.
Do some exercise.
UV protection, so a wide brim hat or UV appropriate sunglasses when going outside to make sure that you're not getting too much unprotected, unfiltered sun exposure.
Got it. All right. Thank you so much, Dr. Pan, for joining us today. And I apologize for we're running out of time for today's program. How about we talk more about cataract surgery and artificial lenses to the next episode?
Sounds good. Thank you very much for having me.
Thank you. See you next time. 那也非常感谢电视机前观众朋友们的收看。在下一期的节目中呢，我们和这个来自比弗利山庄眼科诊所的Dr. Billy Pan 了解更多有关白内障手术方面相关的话题。我们下期再见，祝您晚安。
您正在收看的是凤凰卫视。